As thousands of North Texas kids prepare to head back to school, doctors have a warning for parents. The United States right now is seeing its worst measles outbreak in decades. As our Amelia Magavro reports, there is a concerning trend that could put more and more communities at risk.
Just weeks before students head back to the classroom, a virus once considered eliminated in the U.S. is making a comeback. More than 2,300 measles cases have now been reported across the country this year, the highest number in more than 3 decades. And the threat is now in Texas after 4 cases were reported in Houston this week.
It's said to be the most contagious virus on the planet. If a child gets the measles, about a third of them will get very, very sick. The death rate can be up to 5 to 10% in kids.
Dr. David Winter with Baylor Scott and White says one of the biggest reasons measles is increasing is because vaccination rates have decreased.
The vaccine is safe for children. So in my view, all children should be vaccinated. It's a preventable disease.
So the question now becomes, what does this mean for families here in North Texas? Well, doctors say the biggest concern is when measles reaches communities with lower vaccination rates. And in fact, new state data actually shows that some communities around here are falling below levels that health experts want to see. Data from the state health services shows about 93% of Texas kindergartners were fully vaccinated against measles last school year. But according to the state, some North Texas districts are below that level, including Dallas ISD, where the MMR vaccination rate for kindergartners was just about 82%. Denton, Salina, and Lovejoy ISDs were all below 90%. Doctors say measles generally requires about 95% immunity to prevent outbreaks.
In West Texas, there was a record measles outbreak just in Texas, and there were 2 child deaths. That should wake people up on how this is really serious.
Dallas County Health Director Dr. Philip Huang says the MMR vaccine takes about 2 weeks to provide protection, and that means parents should not wait until the first day of school to make sure their children are up to date. Symptoms can also appear within days after exposure and include moderate fever, cough, runny nose, red eyes, and sore throat.
It's a safe and effective vaccine that's worked for decades. It's a reason why the United States declared measles eliminated in 2000.
In Dallas, Amelia Magavro, CBS News, Texas.